This is a story of a woman who believed she was 5 months pregnant, but in actual fact, she was just 2 months pregnant. What happened? Once you miss your period in a woman in a reproductive age group, the first thing she thinks about is pregnancy. And worst of all, having the signs and symptoms of pregnancy, she can easily conclude that she is pregnant even without doing the test. This is Talk Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women related health issues. If you're new to this channel, don't forget to click on the subscription button. And to those who have subscribed, thank you very much. Okay, what happened to this woman? What was the scenario? This woman actually is a mother of three, so she missed her period and she had signs and symptoms of pregnancy. She had nausea, vomiting, breast tenderness, and she also said she felt movement in her abdomen. So since she's a mother of three, she knew she started her antenatal consultations late, knowing that, oh, I already know everything about pregnancy. So she didn't even bother doing the pregnancy test. She had already prepared herself, knowing that at 5 months she's going to start her antenatal consultation. And that was when she came to the hospital. Once she came to the hospital and her last menses was asked as normal, she gave a date 5 months ago. After a thorough examination, a physical examination, a woman at 5 months, we should already be having a bump on her abdomen. So on palpation of the abdomen, that's the examination of the abdomen, no bump was felt. And once they first of all discovered that, they didn't want to get deep into it, they had to refer her to a doctor to see and evaluate her and make sure that, and maybe if is that she is not pregnant, better counseling can be done. So they just quietly told her that it's important you see a doctor, because if you're 5 months pregnant, we are expecting that we should be having a distension in your lower abdomen, but we can't find it. It's good you see a doctor. So that's when she was sent to me. When I was told what happened and when she came into my office and she explained everything, the first question I asked her was if she did the pregnancy test, and she said no, that she knows that she is pregnant. She has all the signs and symptoms of pregnancy, and for her period, she had never missed her period before. Once she misses her period, she knows that she is pregnant. Some conditions where you might have the signs and symptoms of pregnancy, whereas you are not pregnant, you like your hormonal imbalances, underlying pathologies like polycystic ovarian syndrome, even sexually transmitted infections can cause your period to delay. So with all this, I already knew maybe there was an underlying pathology somewhere which caused her to miss her period for this length of time. I told her that the best thing for us to do now is to do a pregnancy test. Once we do a pregnancy test, we'll be sure if you are actually pregnant or not. She said, it's okay, let's go ahead. We did the pregnancy test and it was positive. At first I was surprised because I had examined her also and discovered that if she's saying 5 months, definitely we should be having already the uterus at the level of the umbilicus, that's the level of the navel already, but we had nothing. I said, okay, it's good to do an ultrasound scan. With the ultrasound scan, you are positive that you are pregnant. And we went for an ultrasound scan and it showed she was pregnant, but at 8 weeks pregnancy, that was 2 months pregnancy. The woman was surprised, but now it didn't surprise me any longer because it's showing that she had that skip in menses. Maybe there were some one or two things. It could even be a sexually transmitted infection, stress, and all that. We don't know what the underlying problem was at that moment. I asked her if she lives with her husband. She said yes, and they had their regular sexual intercourse weekly, once or twice a week, normally, while she was pregnant, because it's still safe definitely to have intercourse during pregnancy. So when I asked her that question and she said yes, I said okay. It means with that her irregularity in between, she got pregnant actually, but now it was not longer that 5 months which she was pregnant, but now 2 months. So we just use this and we explain to her that she is actually pregnant, but let her know that she is not 5 months pregnant, but rather 2 months pregnant. So we started following her up from her 2 months pregnancy. We thank God she was pregnant after. These were just rare scenarios where she actually did not do the pregnancy test. Normally, once you miss your period, it's always important to do a pregnancy test because there are various things. If it's negative and you're having signs and symptoms of pregnancy, there are many reasons. I did a video about that. So after this, you can go back and check on that video. So it's important that once you miss your period and you're thinking you are pregnant, do not assume. Even if you've been pregnant how many times, each pregnancy comes with their own differences. So don't assume the first pregnancy to be the same as the second. Once you're pregnant, do the pregnancy test to be sure. And after the pregnancy test, you go and seek a consultation with a doctor where you're also going to do an ultrasound scan to check if the baby is located in the right position and if the baby has been well formed. So that was her scenario. I hope nobody falls into that kind of condition. So if this was helpful to you, give a thumbs up to our video and don't forget to share to other women out there. If you want to have a private consultation with me, download the Hospital app using the link below and give me a call, either through a video call or an audio call. Thank you very much and God bless you.